Perfect.
Okay, so do I start, Francis? Am I? Okay, welcome everybody. It's nice to see everyone again for our Disability and Universal Inclusion NRT meeting. And we're also, like we talked about last time we met, we're really excited at the fact and prospect that Open is going to make the Heads Up Act part of their Hill Day in September. So we've had a couple of discussions leading up to that, but again, we're really, really excited about that opportunity and for us to have something that we're solely focused on trying to drive. So in case you weren't on the last meeting, I'm Barbie Vartanian. I'm one of the co-leads of the NRT with Ellen and Vanessa. I am the Director of Advocacy and Policy Initiatives for NYU around disability and oral health. I'm also the Vice President of Project Accessible Oral Health, which is a global initiative to improve health outcomes for individuals with disabilities. Like I mentioned, Vanessa, who is the other lead of our group, she's the policy manager for disability healthcare initiatives at Achieva, and then Ellen is the executive director of the Michigan Oral Health Coalition. And then I'll just review some of the desired outcomes of our call today. We're really excited to have Steve Perlman on to kind of give you the background of the Heads Up Act. And then obviously we have Dr. Alan Wong on the phone as well, who's also been instrumental in trying to drive this legislation for many, many years. So again, our outcomes are, to just get a better understanding of the Heads Up Act, talk about the history, the overview of the benefits, and how we can all advocate in our state. And then it's also an opportunity for you all to provide feedback and insight as to how we can strengthen our ask. And there's definitely been a lot of challenges and barriers along the way. So Steve will talk about some of the roadblocks that we faced as we've tried to present and represent this legislation. And then also always an opportunity to connect with the members of our group and share some of the other work that we're all doing if time permitting. So I think that's it, right, Vanessa? Is there any other things, or not Vanessa? Yep. Well, Vanessa or Francis, is that a good lead in? Okay. So I'm going to turn it over to Steve. Like I said, he's going to give you a little overview of the legislation, tell you about the history, tell you why we're still talking about it and why things have not moved forward in all of these years. So, and then we'll open it up for Q&A. And like I said, Alan and Steve are the perfect people to share their insights. So I will turn it over to Steve.
Thank you, everybody. I know many of you on the call, but I appreciate the opportunity to talk. And I don't want to bore you with the history, but I think you have to know where, in this case, we have to know where we came from to get to where we are today to see how we can move forward. Okay. So for those who don't know me, I started out 2 years in the Navy as a general dentist during the Vietnam era. And then for the next 46 years, I did pediatric residency and spent the last 46 years in private practice and teaching, laser focused on pretty much on children and adults with disabilities. So just a little background, in 1994, I founded the Healthy Athletes Program, which is now the world's largest public health program in the world for people with ID. So I've had my finger on the pulse of everything for the last 30 years. And then in 2002, co-founded the American Academy of Developmental Medicine and Dentistry, which is a key player in both organizations. Special Olympics have been the key players in this whole movement for the medically underserved population issue. And then last year, I took over Barbie's, hope I can fill her shoes, as president of Project Accessible Oral Health. So the journey for us started in 2004. Many of you know Dr. Matt Holder. Matt is a physician, got his MBA, and ready to start his career. He was a member of the board of AADMD with us, which is the American Academy of Developmental Medicine and Dentistry. And we were all closely at that time working with the head of the Kennedy Foundation, Steve Eidelman, and Eunice Kennedy Shriver and Sergeant Shriver. So Matt reached out to Steve Eidelman, who, again, like I said, the executive director, about to find a tuition reimbursement program, because instead of working on the African American, Native American, Hispanic health centers, he wanted to devote his education training to people with ID. Therefore, he wanted loan repayment. So Steve forwarded him some information on it. Matt does the homework. So, but what he finds is that people with ID, despite all the evidence as the most medically underserved population, in the eyes of the federal government, they're not declared medically underserved. So Matt does the homework, easy government formula. You know, there are 4 criteria, does the homework, and he said, wow, people with ID are much lower than any of the other MUP officially designated programs. So we said, wow, we're onto something. What an easy fix it'll be, because it's the government's own formula. How can they change it? They need to do it. So working with AAD and Special Olympics, from now on, it's pretty much only that track because nobody really helped us. So working with them, we get an immediate a chance to address the President's Committee for People with Intellectual Disabilities. So there's, you know, President Kennedy started this President's Committee for People with Intellectual Disabilities. It was the new head of the President's Committee was just appointed by Biden. His name is Jim Brett. He's from the Boston area, one of the most passionate, caring people you'll ever meet in your life. So Jim, Madeline Wildo was the president. Jim was just, at that time, he was the second in command there. So we actually, Matt Holder, Rick Rader, a whole bunch of us, Tim Shriver, we go to talk to the President's Committee January 31st, 2005. So that's the first time this MUP issue was on they knew about it. So now people know about it. It was in the report. At the end of the year, President's Committee submits a report. It was in there. Later that year, we get a meeting with Senator Kennedy's staff, who sat down with us and talked to us about it. And at that time, you know, his sister Eunice Kennedy Shriver was working with us with Special Olympics. In fact, wow, we really got this made. We're on the way. Kennedy's staffers said that they thought this was a bigger picture than just the MUP. So they wanted to push it to a bigger picture. We just wanted MUP. But then the Hurricane Katrina hits and nothing happens forever. They drop it. June 2005, I have a personal meeting with Secretary Mike Levitt at HHS. Hand him a binder of all our work and the documentation of, and the plan was to work with the branch designation office of HRSA to move this forward. Nothing happens. 2006, HRSA Committee on Primary Care Medicine and Dentistry actually puts out a paper recommending that people with ID be declared a medically underserved population. Nothing happens. July 10th, at a symposium of the Special Olympic World Games, Senator Harkin, the champion of people with intellectual disabilities and healthcare, is the keynote speaker at a meeting. We're all there. Harkin spends a half hour talking about how they're the most medically underserved population. We raise our hand. Then, Senator, why are they not declared a medically underserved population? Harkin looks to the staff looking like a fool and says, we got to fix this. Again, we meet with the staff, give them our binder, give them everything. Nothing happens. And we can't figure out why, but we just can't seem to get any traction. 2011, the American Medical Association passes the resolution 805-10 stating that the federal government must designate people with ID a medically underserved population. AMA, 2011. 2012, the American Dental Association sends an email to me stating that they will not support it because they feel that it will not improve access and quality care for this underserved population. How can you even begin to explain that? But in 2000, the pressures from the state, all the states welled up. And in 2014, the American Dental Association officially declared and supported medically underserved population designation too. And really, nothing happened until Moulton brought up Congressman Moulton, Seth Moulton, a Democrat, with is it Fitzpatrick, right, Barbie? You're the first one. That's the first time. So now, first time, the Healthcare Heads Up Act, which is Healthcare Extension and Accessibility for Developmentally Disabled and Underserved Population Act of 2018. So you can take it, Barbie, you can take it after 2018, but it's been okay, so it's still, why doesn't it go anywhere? Well, one of the reasons why it didn't go anywhere, and it's never even scored. And this is, I'm not a politician and I'm not a lobbyist, but basically Moulton, who introduced the bill, his career has been based, he went to Harvard, he's from Massachusetts, he was in 3 tours in Afghanistan. Every bill that he supports has been for military and that kind of stuff. He brought this bill forward because he has an uncle with Down syndrome. But as I've learned, if you have a congressman and he's pushing for you, if it's not in the top 10 things that he's got going for him, he's not going to do it. And then not only that, but we can't seem, this bill needs to go before the energy, the strength comes from the Energy and Commerce Commission. And that's where we have to concentrate. So I think it's a pretty complex history. So you can imagine talking to you all the frustration that I've had since 2004, because every time we sit down with somebody in power, I think I've been with 3 health education secretaries. Every time we give them the binder, it goes to their staffer. They said, we get it. And then nobody does anything. So we know now that a lot of the pushback has become from the big disability world. So we're only targeting people with ID. If you look at the current literature in the United States, they'll say roughly 7.5 million people with intellectual disabilities. That number is so far off because, number one, children under the age of 5, it's only blind and deaf. Okay, so there's only 155,000 of those children. We know children under the age of 5. How many kids with autism and ADHD now? We don't even, it's incomprehensible. But that's not an easy fix because that has to be through the survey, right? The Bureau of, no, what is it?
Census Bureau.
Census Bureau, right? Sorry, guys, I just had a stent put in Friday. I'm a little confused. So anyway, that fix has to come from the Census Bureau. But we've been working, I don't know if any, you guys know Institute of Exceptional Care with May Pham, who's a physician from HRSA. We just published an article in Helen Journal. The number is really 12 to 15 million people with intellectual disabilities. But actually, that's a much more manageable number to get medically underserved than 52 million Americans with disabilities. So the only chance we think we have to target that this can only be the medically underserved people with intellectual disabilities. So that's one of the problems is underreporting. What else? Barbara, you want to take it over now?
Well, Steve, do you want to talk about some of the benefits like of the designation?
Okay, yeah, so the biggest, we were told to pare down the bill that it's too big, okay? So if we want, what's our biggest ask? The biggest ask is clearly loan repayment, because that's a huge obstacle out there now. So whether you're a physician, a dentist, a nurse practitioner, a pharmacist, so whatever it is, loan repayment is critical. So that would be our number one ask, would be loan repayment. The other thing is that there would be, if they were declared a medically underserved population, there would be money for research. Like, let's say a school wants to start a special care clinic. Right now, because they're not medically underserved, there's no money for them, federal money to open the clinic. If they want to hire faculty at a school, that's another, that's one of the biggest issues that we know in healthcare delivery for people with intellectual disabilities, and lack of training in school. Well, that's, if you can't hire faculty to do it, So it's payment of faculty. And the other huge thing is research. So if you want to study research on sickle cell anemia with African Americans, they're an underserved population. So there's money for research. You want to study fetal alcohol syndrome, fetal alcohol disorder now, spectrum disorder on Native Americans. Yes, underserved population, you can get money. You want to study aging and dementia and Alzheimer's and Down syndrome? No, they're not a medically underserved population. So the thing is, if they're declared MUP, we don't have to fight for loan repayment because loan repayment automatically goes with MUP status. Okay, so the bill was introduced in 2018 by Alderman Fitzpatrick retired. Somebody else co-introduced them to him. So it's introduced in the 115th Congress, 116th Congress, 115th Congress session in 2017-18. It was reintroduced in 2019-20, and it was reintroduced on June 13th in the new Congress, the 118th Congress. So that's where it is. It's still sitting there in the new Congress, just reintroduced. It's never been scored. And one of the things that we've been talking about is taking it away. One of the strategies was Moulton, like, give it up. You're not doing anything with it. Just give it up and let somebody more powerful, connections to energy commerce, but he won't give it up. So, Vanessa, that's your field of expertise.
Good pass, Steve. That was good pass to Vanessa.
Yeah, thanks for that hot potato, Steve. Yeah, so it's really just been sitting in going nowhere. And Fitzpatrick, who is from Pennsylvania, is really gung-ho to move it. But there's just a disconnect there. And I saw that Debbie Dingle signed on, co-sponsored this time around. And I think it's Morel. We also had, after some discussions with Melissa Burrows at Families USA and Stacy Auger at CareQuest, the idea was kicked around that the Senate might be a little more friendly climate this time around, although that's a lot of folks feel like that's debatable. So we've had conversations with several help staff, and I know Barbie is also, Barbie's meeting with Michael Gemmell McCormick and Casey's staff also, but we met with Senator Patty Murray's staff. Of course, we met with Senator Casey and CareQuest graciously hooked up a meeting with Senator Markey's staff. Thank you so much to Amy Sanchez, who's on the call. And we're working on, we're making some inroads. We have a meeting with Disability Rights Maine, who's interested in jumping on board, and they have good connections with Senator Collins. We're really looking for Republicans in the Senate. And Senator Sanders' staff, Sarah Mueller, we just had that conversation also. So we have meetings coming up with Kim Moody from Disability Rights Maine, and they have great connections with Collins and King. And I was really hoping, I invited John Zasada to be on the call from Alaska Primary Care Association, because we're really, Senator Murkowski is another one that we're hoping to get to. And Beth Pierce is on, great. And Tanya Dorf-Bruner is here today. Thanks, Tanya, for showing up. And so we're also targeting Moran from Kansas, as well as, oh my gosh, the name is escaping me, Tanya, Moran and Marshall, that's it. Yeah. So, so that's kind of where we're at. We actually have several meetings coming up. This is kind of starting to mushroom, hopefully. So National Down Syndrome Society just came out supporting the policy. And so hopefully they're coming on board as well. And oh my gosh, I'm drawing a blank on some of the other organizations, but it's really starting to pick up speed. The ARC of US is supporting it, and I think that that's going to be a session at the upcoming ARC National Convention as well. So I'm hoping that this is kind of finally starting to snowball, although like Dr. Perlman said, this has happened before and then nothing happened. So
not this time, Vanessa.
So we're just hoping at this point to put so much pressure on that they can't say no. So and the answer is always, you know, this costs a lot of money, and of course doing the right thing always costs a lot of money. So that's really one of the things that we're going to have to
Vanessa,
Yeah.
this is only splitting the pie. It's not any increase in funding. That's the thing that surprises me all the time. We're not asking for funding. We're asking for the pie to be split differently. So it can't be a funding excuse. We
have to make the pie bigger, because that's why, because what everybody ends up fighting each other when it's like a zero sum mentality. I mean, with all due respect, I think we just have to really make the argument. I mean, how many people with ID end up in the emergency department all the time, not just for dental, for a lot of stuff.
Absolutely.
Yeah. So, I mean, and we don't even know how, like you said, Steve, we don't even know how many people accurately we're really talking about.
No, because when they check into an emergency room department too, it doesn't list their intellectual disability as a it's not part of the diagnosis for the problem that they have. So we know it's a huge amount because, face it, all over the country, what's the safety net out there? It's the emergency rooms, right? And so typically all these group homes, they'll have a nurse that takes care of them. They'll have a physician consultant, but it's all emergency room based, which is the most expensive healthcare that you can have.
So Steve, Tanya has a couple questions. One of her questions was, is there a sense of why the bill hasn't been scored yet? And I know you kind of touched on it, that one of the reasons is big disability is been a barrier. Cost is obviously a barrier. The placement of the two legislators we don't have the right people on the right committees. That's another reason why.
And the pushback, there's also been pushback from the National Dental and Medical Association and the Hispanic Dental and Medical Association. They don't want it. They won't support it. They don't want to help it. It's that even though the documentation, I could send them countless articles on how many kids and adults there are with disabilities, and African American, Hispanic, not interested. They don't want to cloud the specific issue that they have, whatever it is. So we're getting pushback from big disability, and we're getting pushback from within our own community, that the healthcare providers from our own community. And I don't know how we can fix. Honestly, I don't know how we can fix that. I mean, we've pointed the problem to the most powerful people that could make a change, and yet nobody's doing anything. You know, Special Olympics is going to support us on the lobbying for this, and it's the only bill that they've ever endorsed and will put their advocacy efforts into. And Alan, have you shared with the group the great relationship now with the American Medical Association and the American Dental Association? We just in Denver at our AADMD meeting, we actually had representatives from the American Medical Association, American Dental Association, and they both want to help us on this. And that's never happened before. Both professions sitting at the table at the same time. The good news for everybody is that the National Council on Disability, you all saw the report that they just released. I mean, how more indicting, how much more evidence do they need? It's not working. So we have the National Council on Disability. Unfortunately, our representative was just removed. There's no healthcare professional on the National Council on Disability now, which is unconscionable. You know, we had Dr. Rick Rada. He was a great voice for us that did everything he asked in the last, but Biden just replaced him with a non-medical person. And Jim Brett, those of you who heard before, we have a close friend in Jim Brett, who's head of the President's Committee for People with Intellectual Disabilities. So the two organizations that really we need to support both completely support all our efforts. So we've never, you know, so that's in line. And you guys out in the field now advocating, we've never had, honestly, I mean, you heard my sense of frustration since 2004 that we're still banging our heads against the wall, but we never had coalitions and things that we have now. Alan, you want to say about the President's Group and how not only was it one and done, but quarterly meetings?
Right, exactly. So thanks, Steve. So alignment is a key right here, and we've never had so much in terms of medical as well as dental. So we've been continuing this movement and alignment. We call it the President's Work Group. And there's about 20 different work groups working together, including, I think, HRSA and CDC and a few others that want to align as well. And the big voice is we're standing behind the National Council NCD's report and outlining that as part of our strategy as well. So if we can all do things together, they'll hear one loud voice. So the report that the National Council had was 3 recommendations that we agree. One thing that we keep fighting each other is the definition of IDD. And we need to have one definition that we could all agree upon. So we're all trying to band together to do that. So Mary Foley from MISDA and a few others, we're trying to propose a universal one that we can all stand behind, because we keep on pulling at each other for the wrong definition. So getting one standard definition is very important as we move forward, because if we can get this defined federally, then everything floats down to everything else. And we're
pretty close to that. We should have, if everybody on the email list, Barbie, we should have that one definition in a couple of weeks. We're on the final stage of that.
Okay, great. We can share that. Yeah. And Alan, I think that's perfect what you said, just the alignment and just having you guys all on this call. And again, the fact that Open is considering, Amy corrected me, considering the heads up legislation for Hill Day. And I feel like we got to lobby to that group as well, because it's so important to have, I think, this organization behind this particular legislation. And like Steve mentioned, Special Olympics has a new government relations person. His name's Christian Cleese, and he actually used to work for Senator Casey's office. He's great. He's super excited and on board to help us drive the legislation. And ironically, after speaking with Amy and then speaking with Christian right after, they both echoed the sentiments that, as you know, we've got the legislation in the House, but really a companion bill in the Senate is really where we're probably going to get the most traction from. I know Vanessa kind of touched on that, and there's different ideas around that, but both of them said it resoundingly that they think that that's something that where we might gain more traction. Casey has great relationships with Cassidy, like we just talked about, Collins, Murkowski, Moran. They've all worked very closely with him. So if we can identify a Republican, that was the other resounding universal sentiment, was we need a Republican to come to the table on some of this legislation. Casey has a bill right now. He introduced a bill, a Senate bill. It's 1219. When Christian reviewed it, he said it's really an umbrella of heads up. It doesn't specifically speak to everything within that legislation, but it is an overarching umbrella. So do we go to Casey's office and say, hey, can you do a separate carve out and integrate some more of the language of heads up? So I have, we're supposed to be meeting with Michael McCormick, who's Casey's disability director, and Christian in a couple weeks when they all return from the games and things like that. So And then the other big takeaway, and I don't know if Amy wants to chime in, I don't know if she's still on. I don't see her anymore. So she,
She
just
had to
really.
jump off.
Okay,
Her
so just
daughter.
really, simplifying the ask as we, if we are chosen to be one of the discussion points for the Hill Day, she just, we all know this, you simplify the ask. We have a short amount of time to make our pitch. So, and one of the things Vanessa, made a comment of is the designation itself. That has to be like first and foremost. We need that medically underserved designation. We need to talk about access, and then obviously loan forgiveness, like Steve talked about. So, a few months ago, we started to do our own, Hill Days through the help of Henry Schein's government relations person, and it was myself, Steve, and Mary Foley, and we kind of broached it from 3 different subjects. We talked a little bit about the history. Mary talked a little bit about Medicaid and some of the creative and alternative ways that we can take a look at that. And then I spoke to what the private sector is doing, because that's always really important when you're making a legislative pitch. They don't want to hear, what are you doing for me? They also want to know how the private sector has been engaged in the discussion. So we've been able to talk about the great work that Delta Dental is doing, where they've expanded their benefits for this population, and it always seems to resonate. So those are and we talked to Amy about that as a way in which we can try and propose how we want to formulate a game plan when we're meeting with these various members. So that's just kind of, some of the discussion points. So let's open it up now from here. If anyone has any thoughts or suggestions, again, we really need Republican help on this. And first of all, we need to get open to tackle this as letting us be a part of Hill Day, but once we get through that hurdle, then, if anyone has any suggestions or comments, thoughts. No, Alan, do you have anything else you'd want to?
Well, no, I think we're all in alignment. I'd love to, I'm going to invite whoever would like to invite, we have a President's Advocacy Work Group Advocacy meeting coming up on the 24th, I think, is that Monday coming up. And I can send some information, or 26th rather, 26th, if you want to hear what we're talking about on the President's Work Group. Those who are really interested, let me know, and I'll invite you to listen in on what AMA, ADA, and ADIA, and a few other people are talking about as we're trying to get more in alignment and move forward.
Okay, great. Francis, do you want to touch any more? Do you want to explain a little bit more about Hill Day, or do you want to kind of take us down what that path might look like?
Yes. So we have Hill Day set for September 12th and 13th. So if you have not been a part of Open's Hill Days in the past, this year we're actually hiring somebody that's going to be scheduling all the visits, which we used to ask open members to do themselves in each state. So now I believe that should go a bit more fluid. But so we will spend the time to educate members about the asks themselves. So have all the talking points, any way that we can strengthen these asks. I know not only this group, but also the rural network response team has really been making the case for fiscal savings. But so all that to be said, we'll have the first day really about, and there will be some lead up webinars as well, kind of like there's 3 asks total. So a webinar to explain each of the asks in depth, if you want to participate in any of those, and then a more condensed version on the day of. And then I believe it's on day 2 where all states will be conducting the visits. And then we should get a good summary report out of that, what's working, who's been connected with. So the initial process, we had met with all of the ROCT leads, the Regional Oral Health Connection team, as well as each of the network response team leads. I believe that was maybe a week and a half ago or so, but had everyone made the case for what they thought the strongest asks were. So now the policy network response team, they'll be meeting, and I can get you that date if anyone's interested in joining. But so that's where they'll take all of the feedback from that leadership meeting, which included a survey at the end of the meeting to say what would be the, how does everyone feel about all the asks that were presented? So on the next, thank you, Tanya, June 30th at 1 p.m. Eastern. So on that meeting is when the final decisions will be made based on the feedback that was provided. Oh, is that incorrect?
The discussion will continue. I don't think the final decisions are going to be made that day.
Okay.
Yeah, I don't think, yeah, just discussions will continue. It'll get a lot closer, but we a little surprised if it's final that day.
Appreciate that. Does anyone have any questions about the format of the Hill Day structure or anything else related?
I guess I just want to point out, even if we don't get included in the Hill Day policy asks, it's still fantastic if individual network members and like some of the other groups who are getting involved, like Steve mentioned, we need the folks on the Energy and Commerce Committee, and we need the folks on the Senate Help Committee. So even if Heads Up doesn't make it to the final policy asks for Hill Day, which we're all hoping that it will, you know, there are still opportunities for advocacy there, and we still need absolutely everyone on this call, no matter what.
Yeah, absolutely. I think even like you said, if we don't make it, we'll do our own, you know, I mean, it's so important. So irregardless, I mean, I think we're all very dedicated to this subject, and I know all the other asks are equally important, but when you talk about this community and you understand that access to oral health care is their #1 unmet need. So even within rural communities, there's people with disabilities in those rural communities that are, you know, so we just have to keep thinking about the, you know, how disadvantaged this population truly is, and that all of the tremendous barriers they face in accessing absolutely everything in their daily lives. So I think we just have to continue to remember that. So, and yeah, and there's so many advantages for this designation, you know, and reasons for it, and things like that. So.
Well, and the Heads Up Act, you know, it's like I always tell people it's a 3-for-1, you know, so it's medical, but it's also behavioral and dental health. We have workforce issues across the board in all 3 of those areas. You know, plus as a network and beyond, I mean, it checks a lot of boxes that we're talking about. So Heads Up, you know, and not only does it make the designation, which is critically important, but it also in the bill as is, it includes mandatory integrated and comprehensive dental, which is something that, I mean, I've been in this network a long time, and every year we're talking about integrative and comprehensive dental. So that's another big point for us.
I want to piggyback on that as well. When this group met for the first time this year for our brainstorm meeting, we talked about both integrated and comprehensive. What do those terms come down to? And I think having an agreement about what that might be. And so I know if there's another group that's working on language around individuals with intellectual disabilities, and then, you know, I think there was some thoughts about the EPS DDT framework that might support that. But if folks have thoughts on that, I think that's another area that's ripe for thinking.
Yeah, we had that conversation with Fitzpatrick's office, and I wish we could have that conversation with Moulton's office, but Fitzpatrick's office was very amenable to using the EPS sorry, I never get that right, framework in terms of, you know, what's considered comprehensive.
Yeah, I don't know, Alan, do you have any thoughts on that? Like the definition of comprehensive, and or do we have anything already out there? Or?
We're getting really close.
Okay.
We should know something next couple of weeks, and I'll share that with you once we get it.
Great, awesome.
Yeah, so So whatever you get, Dr. Wong, I'm sure Fitzpatrick's office would be interested in seeing it. They've been really agreeable and open to that.
Great.
Okay, anything else, Francis, from here? Do you think?
I
No?
did see Kathy Dwyer shared that they use the EPSDDT in Louisiana's Act.
Oh, great.
I know in our planning conversations, I'm new to this world, but apparently Louisiana has done some great things that we also had talked about learning from. So
Yes, they have. I didn't even see you on the call, Kathy. Hi. Yeah, you've done wonderful things.
Sorry, I'm in transit and I was in a place where I couldn't take off my mic, but yeah, I'm happy to answer any questions about what we did in Louisiana. I mean, that was the first thing we did when legislators asked us what we needed covered. And I said, we'd like the same thing that's offered through EPSDT. And they went for it, so.
That's great. Yeah, Kathy, I don't know if you want to quickly talk about your success in Louisiana with the Medicaid carve out for our population.
I would love to. We started off, what we have is a state advisory committee for our Office for Citizens with Developmental Disabilities. And it was at that committee that another family member, Mary Kay Cohen, who's a sibling of a young man with intellectual disabilities. And I have a 46-year-old daughter with intellectual disabilities. We were both having trouble finding dental services for our loved ones, especially those who had pretty severe aversions to anyone probing, in their mouths. There was like a 5 to 6 year waiting list in order for us to even get into a hospital for general anesthesia, just for a basic dental exam. So we proposed at the State Advisory Committee that we form a dental task force for adults with IDD. And we started meeting in 2019. We invited all the stakeholders, representatives from the Dental Association, dentists, hygienists, parents, ARCA Louisiana, anyone we felt could contribute to, what the barriers were and what the solutions need to be. And we worked on that for about a year and then wrote a report listing all of that, the barriers and solutions, using some of NCD's reports that they have written in the past, or recommendations, and then reached out to all our legislators who we knew had family members with intellectual developmental disabilities. And Representative Rhonda Butler was the first one to step up. And so we worked with her in writing the bill and just started our advocacy campaign, and it passed unanimously through all committees in both chambers, House and Senate. So it was implemented, I want to say last July was the first time we actually implemented it. They needed the first year just to pull together all the policies and procedures and so forth, because we added some codes, like we added a code for dentists to have additional time for case management. We also increased the reimbursement rate for anesthesia and hospital fees, because that was mentioned as some problems, in terms of trying to get into the hospitals, for those that needed general anesthesia. But we now have 2 dental providers, or dental benefit plan managers, I should say, DentaQuest and MCNA Dental. And we had a few little kinks in the beginning in terms of, what we did was we limited to the population that were receiving one of our disabilities waiver, developmental disability waivers. So when trying to pull those out of the data system, there were some coding problems that probably eliminated some people that kept showing up as ineligible. But once we worked those bugs out, everybody was automatically eligible if they were a waiver recipient. and would receive information from their corresponding dental benefit plan manager. And the only problems I'm seeing now is finding dentists to serve this population. We have, I think, Dr. Morgan, who is the president of our Louisiana Dental Association, has identified 60 dentists, but we don't feel that's anywhere near enough that we need to serve the roughly 13, 14,000, I think, that, are eligible for these services. So we've also been working on training, pre-doctoral, postdoctoral. We were hoping to get the Dental Association and others to agree to some mandatory CEs in special needs dentistry. And we were hoping for our dental school to enhance their curriculum. We've shared a lot of information that Barbie has shared with me about what's been happening at the University of Pennsylvania and other places. So we're still working on that part just to try to increase the workforce, but that's where we stand right now.
Great, Kathy. Thank you so much for sharing. It's the
Yeah,
power of a parent right there.
Thank
And the
you.
importance of advocacy. I mean, and Kathy just laid out a whole list of other things that we can be advocating for, making mandatory licensure requirements and CE requirements. I mean, there's so many different things we could go down the path of, but
Right.
yeah, Louisiana's doing great things. So yeah, so thank you for sharing. So yeah.
And there was one more thing, if there's time, that we want to try to make sure all training, that it's incorporated in all training, is basic ABA or positive behavioral intervention support techniques. My daughter used to require general anesthesia for her general exams. We have since gone to, I think some of you know Dr. Jacob Dent, who is also the father of a young man with autism and has received some basic training, not intensive, from his son's ABA therapist. And he was able to get my daughter to open her mouth and cooperate without any problem. Now, he wasn't able to do a thorough exam like a dentist would do with me, but he was able to brush her teeth, view them, count them, see what's there, what's not there. Much better than having to go under general anesthesia. So I really think it's important that we try to teach dentists those basic techniques, because it would, eliminate the risk of having to go under general anesthesia and any other techniques that might be frightening, for our loved ones. So that's the other thing we're trying to work on.
Yeah, Kathy, I'll just tell you real quickly. So at NYU, we just hired, she was a resident and now she's full-time faculty and she has her ABA license. So she's training the dental students now in the center, those types of techniques, and it's been invaluable. So
awesome.
Yeah, she is amazing. So on a side note, so, okay, Francis, where do we go from here? We want to wrap us up?
So I have preloaded in the chat, so I'm dropping that in now. Our open updates, the virtual Hill Day, as discussed, it's September 12th and 13th. So that registration link is there for you all. Our annual meeting has been scheduled. It's now October 24th through the 26th. That will be virtual, so stay tuned for more information in regards to that. And then Open and CareQuest Institute are co-hosting a learning community series. So if you had missed the initial launch where we brainstormed through the rest of the year, we'll be kicking off on June 28th at 3 p.m. Eastern with DEI in practice. So the registration link for that is also included, and this will be shared in the notes. We'll also share the recording from today along with the notes and next steps. So I believe we're meeting 2 months from today in our standing meeting time. So look out for all of the great things coming to you between now and then, and looking forward to seeing you all.
Yeah, thank you guys all so much. Really appreciate your time.
thanks, Dr. Perlman and Dr.
Yes, thank
Wong
you.
and Tommy Dorf-Bruner and
Yeah,
Gary.
everybody.
for being here.
Yeah, and thanks for all you guys. Thanks for all your support for us too. We appreciate
Thank
it.
you all.
Thanks, guys.
Thanks, everybody.